Good morning, everybody. I'm Michael Davidson. I'm the Executive Director of eXplore Lawrence, and we welcome you to this Zoom webinar that we have put together with some really great panelists. I want to welcome our local stakeholders, people in Lawrence and Douglas County. Also want to welcome any city and county officials who might be joining us, and tourism leaders from around the state, who we also invited to be part of our program today. Just some basic ground rules before we get started. We are going to be recording this, and this will be uplifted onto our Road to Recovery landing page on our website. We have a Q&A and chat set up. Q&A is going to be managed by Kim from our office, and chat will be managed by Andrea. We ask you to post any questions you might have, but we're going to respond to the questions after all of our three panelists have presented. So, as we all know, Governor Kelly has put out a four-stage plan to reopen Kansas, and we are phase one right now. Douglas County also will be looking at the plan and making their recommendations and modifications to it, as the county really will be the organization or the governmental body that will allow us to open up. So as we have been thinking about opening, I think the challenge we're going to have, and the challenge we see from the tourism industry, is that there is a pent-up desire to travel. We all know that, but it's being coupled with a fear for safety. So what we want to explore this morning with our panelists and with the conversations we'll have with everybody on the call is, how do we prepare for that? What are the steps that the hotels have to do, the restaurants have to do, how the county views this? So when we're ready and when we're going to be inviting visitors again, we can inform them of what safety steps we've taken to make them feel secure. So we have three great panelists. We have Robert Hernandez, who will be our first speaker, and then Rebecca Smith, and then Rick Martin. So Robert, we found Robert from a great article he wrote, and the article was how each hotel department can begin preparing for a new normal reopening. We reached out to Robert, who has a great background, has been doing this kind of research and focusing on the hotel industry for well over 17 years. He is Vice President of Hotel Mathematical Revenue Discovery for Orient World Lab, or OWL, as I'm going to call it. And they have a great website, and their website is forsmarthotels.com if you want to go check out things. They're an organization, a combination of mathematicians, behavioral scientists, informational technology veterans, and a field of statisticians who looked at the hotel industry and have a passion for the industry. So we're going to turn it over to Robert for his presentation. Robert, thank you for joining us from Florida.
Thank you very much, sir. I appreciate you guys hosting this webinar, and let me try to share some information which hopefully will be interesting to everyone who's listening. So again, my name is Robert Hernandez. I work on hotel analytics and optimization. So basically, I look at the inefficiencies in the hotel and the hotel industry and try to suggest how to fix those. But over the last couple of years, I've been working on hold on, let me go back. On one of our divisions, which is called Review Respond, which what we do is that we help hotels respond to their reviews in a more intelligent way and a more personalized way. And from the data analytics that I've been able to gather from that part of our business, I'm going to be sprinkling this presentation with some stats and some information which will help you beat the fight to get better reviews while you're reopening. So I'm going to tell you where to focus on so that your reviews come out more positive, even though we're going through a bad situation. So the sources that I've used, because my background is not in hotel operations and it's not actually running a hotel, I had to do a lot. My background is really in research. I went through 52 different articles on how to reopen. I looked at 17 different guidelines from different hotel associations and industry organizations. I listened to 21 webinars, and I had dozens of direct conversations with general managers that we work with and operations people. And even though 90% of the information out there is repeated at this point, because we're still at the beginning of this process where everybody's just pretty much giving the same general advice, there is some information that I found to be very unique and very helpful. And I'm just summarizing it here for you so you save a lot of time not having to scour everything yourself. So the basic message that I want to give, if you come up away with nothing, is that you can do this. The hotel industry, by all the research that I've done over the last 15 years, is one of the most trusted industries across every industry. So we're more trusted than the automobile industry. We're more trusted than government. We're more trusted than basically any industry. So you do have that trust on your side already. So, you know, it's just a matter of laying out the processes for you to be able to get this reopening started. There is not going to be any good time to reopen, so you might as well do it as soon as you possibly can, or as soon as it is safe to do. So basically, let's cover the basics. I mean, every single one of you knows that this crisis is going to involve you changing the way that you do things. But hotels have always been cleaned before, and you've always done deep cleaning before. But now the only difference is that you might have to do deep cleaning a little more, and you're going to have to re-clean more often than you usually would. There's a lot of guidelines out there that say that the hotel industry might have to use stronger disinfectants or more industrial disinfectants than it did before, but that's something that you could find and check out yourself. You all know that this has everything to do with, you know, making sure that the high touch points and the surfaces that are constantly being used are the ones that are always clean. So that's where you're going to have to monitor constantly. And you already know most of this information. Again, it's about masks, gloves, shields, and separators. You know, they say now that masks are the new seatbelts. You know, you could use them or not, but people recommend that you use them at all times. Unfortunately, one of the victims of this process is going to be the reduce, reuse, recycle. We're going to have most recommendations are that we go to completely disposable process, or materials. So you're going to be seeing a lot more of that. I think the most irritating part of this entire process for most hotels is that you are going to be the distancing police within your property. So that's going to be a constant process that you're going to have to put the head count on and make sure that people do. And it's going to involve, you know, the emotional intelligence of the people that run your hotel to be able to make sure that the distancing, which is the most effective way to control this pandemic, is abided by. You should focus on the employee's safety as much as the guest safety. It doesn't matter if one of your employees gets sick or one of your guests gets sick. You're going to have the same effect. So don't think that this is just a front of the house problem, that it's not a back of the house problem. This is definitely a problem throughout the hotel, and you're going to have to deal with it with as much energy and seriousness for when it comes to your employees as when it comes to your guests. But mostly, most hotels, what they're thinking of doing is just letting occupancy lead the process. You know, you're going to change the rule set by which you operate depending on the occupancy you have. There's things you're going to do at 20% that you then are going to do different at 50%. So just let the occupancy work through the process. But again, what I'm most concerned with is what it's going to be like for the guest. And for the guest, there's going to be a new normal in their guest journey, and that's going to go beyond sanitation. So the guest first starts by research and booking. So what I found in the research is that most websites are going to need some kind of COVID page. You're going to need a disclaimer or actually an informational page telling people what it is that has changed about your hotel. Most hotels right now don't have anything even similar to that. They have a simple pop-up, or they have just a disclaimer saying that things are being changed because of the COVID crisis. The OTAs, there's not a single hotel on Expedia that has a different description than it did before the crisis. So the OTAs right now are not being populated with new information. And the reason why I say this is because you are going to have to start responding to your reviews. This is going to be the very first source, and I know I'm biased by saying that, but the very first source of information that's going to come from your guests is to see how you have responded to any issues that have come up that are COVID issues. And your responses to your reviews are going to be the source by which guests can tell how serious you are about this process. And again, the OTAs don't have that information, and most websites don't have information. So basically, they're going to go on TripAdvisor and they're going to go on the review sites to see how it is that the stay is at, how a stay would be at the hotel. But listen, the number one visited page on any hotel website is the photos page. So if you could use that page to show images of you mitigating, whether it be cleaning, whether it be how you've spaced out your restaurant, whether it be people actually checking in, that will work in your favor. And if you could do videos, that would be even better. Again, the most important thing, just to skip forward, is transparency. You definitely don't want the guest from a business or definitely a reviews point of view to come in having one expectation and then you delivering another. So make sure that you could be as transparent as you can. People now are trusting transparency over you trying to surprise them with some kind of experience. Listen, if we were back in November and you were to walk into a hotel and you would see this scene going on, you would freak out and leave. But now if you walk into a hotel and you see this scene going on, you think that you're getting luxury service because hygiene is the new luxury. So make sure that you be as transparent as you possibly can, because you're not going to scare people. You're actually going to make them feel a lot better if they see that you are mitigating any fears that they have. Okay, so now arrival. What are other hotels doing for arrival? What are they indicating that they're doing? Okay, so Valet, they're limiting only to the handicapped, and they're definitely not trying. They're not trying to engage any vehicles. They're not trying to open cars. They're not trying to park any cars. Signage is going to be everywhere. You cannot have enough signage. Make sure that the signage is not only in your lobby, but it's on every floor. It's on every touch point. It's in the bathrooms. Post guidelines, but you could also distribute them. There's some hotels that have indicated that they're actually going to leave their new behavioral guidelines in the room when the guest actually checks in. Some hotels are even giving out personal sanitation kits. That way you can make sure that they can't, that nobody can complain about the fact that you didn't give them a mask or that they have an excuse why it is that they're not wearing one. The more high-end hotels are using things like thermal cameras where you can detect the actual temperature of a guest. And then if any guest fails that test, they're going to temperature check guns. In Asia, they're going straight to temperature check guns. I don't know if that's going to be viable in the US just because it's a cultural difference. But hotels like the Wynn Hotel they've published their guidelines saying that if anybody fails the first test and the second test, if they fail the thermal cameras test and they refuse to do the the temperature check gun, they will not be allowed in the hotel. So I think that's going to become a new normal for the temperature gun to be used for anybody that's walking into a hotel or checking in. Hotels are also setting aside COVID-19 suspect rooms. If they suspect that anybody is actually sick, there's some room where they're going to be moved to, and then there's going to be an evacuation route out of that hotel room straight onto into whoever it is within your jurisdiction that deals with new cases. And definitely the Bellmen are not going to be available unless it's upon request, and they're definitely not going to be allowed into any rooms. The check-in process. If you work for a brand or you have some kind of PMS system that has an app check-in, this is the time to use it, regardless of whether people complain or not. If there's any way that you could receive information via email that could allow the check-in process to be completely touchless, or some people are impersonal, or maybe you don't do check-in at all. Maybe they provide the information once they're in the room, and you just trust the fact that it's the right person checking into the right room. If they have to go to the counter, there's, every hotel now is setting up physical barriers. A lot of them are setting up plexiglass that comes from the ceiling down. Think more of in terms of a bank teller than a hotel. There has to be a plastic barrier in between your employees and your guests, and spacing markers, which everybody's now used to because of supermarkets. Make sure that there's no queue building up in front of the check-in process. But as much as the process can be contactless, that's really what you're going for here. So again, make sure that your guests and your employees are touching as little as possible. Let's move on to room entry. Elevators. Elevators are one of the sources of the most negative reviews online. People hate waiting for elevators, and when a hotel has an elevator that is down, you will see from our stats, we know that occurrence will create more negative reviews than anything else. You're going to have a problem now because there's only a maximum number of people allowed in elevators at a time, and that has to be monitored. Now, that's easier said than done, because you can easily monitor people getting on the elevator in the lobby. Now, how are you going to monitor everybody getting on the elevator from every other floor or coming down to the lobby? So you have to think about how you're going to do that. Therefore, post elevator guidelines on every single floor. Don't just do it in the lobby. Make sure that people understand that the rules apply on the way up and on the way down. And again, when people are trying to go into the room, no bellman is going to be allowed in there. So don't even send the bellman up with them. Just send them alone with the cart. Okay, in room. What most hotels say that they're doing is that they're actually putting sanitizer bottles inside the hotel for the guests to desanitize whatever area they want. They're removing the mini bar. I'm surprised that they're keeping the in-room coffee. Most hotels are saying that that's something that they're keeping. At first, they said a lot of the research that I did showed that they were just going to remove that, but now a lot of hotels think that they could do that safely. There's definitely going to be no dry cleaning. We're bringing back travel size soaps and travel size amenities in the room. There can't be anything that could possibly be shared or stay or go from one state to another. Anything that's decorative in the room, duvets, throw pillows, anything like that. That has to be removed. Remove any kind of magazines, and definitely turn off all ice machines. So that's generally what we're seeing that most guidelines are saying that they're going to do. Food services, and we're going to have Rick talk about more about the food services. And he's probably going to be a lot more clear than I am. But basically, these are the basics that we see. Most hotels are going with room service only. Limited outlets, limited menu, limited kitchen traffic. You definitely don't want your employees inside a kitchen for longer than they have to be, especially if they have to be close with each other. If there's any way that you can move your food, your prep stations around, that would be ideal. No complimentary food and beverage. Nobody's going to have complimentary coffee out or anything that they have to be worried if people are going to pass on any kind of disease. Whoever had free breakfast is mostly going to go with grab and go breakfast. That's what most of the brand guidelines are saying, or they're going to switch to table service. But again, everything is going to be disposable and pretty much, take it with you back to your room. Don't stay here. We don't want any kind of interaction in between guests, and definitely no evening reception or anything that's kind of obvious like that. We're going to disposable menus, disposable containers, disposable utensils. Again, I don't think this is going to be, we're sort of backtracking on the whole sustainability thing, but it's what the situation calls for right now. There's a general advisory that's going to be on most branded websites that it says that you're going to adjust the menu to accommodate COVID-19 guidelines. I personally think that might be a mistake. You need to be like I said, you need to be as transparent as you possibly can about what you're actually going to offer. I see this being a problem for the reviews that guests are going to post later on. Again, a lot of bad reviews have to do with the fact that people go to your hotel with one expectation and then they meet another reality. And if they have to imagine what menu items are going to be available at your hotel and when they get there, they're not, that's going to be an issue. The spa. I searched everywhere for spa information over the last 4 weeks, including the International Spa Association, and there's really not a lot of detail. It's a high risk situation right now. Most spas are still going to stay closed. It's going to be a capacity control issue if you want to reopen it. I'd really love to see more input from somebody who's a professional in this area, how they're going to reopen the process and look to make sure that everybody stays safe in a situation where it's really high touch and very closeness. But again, most of the guidelines that are out there for spas are incredibly general. They'll say something like, "Oh, make sure you maintain the area clean." Okay, you maintain the area clean. Okay, what does that mean for the spa? That could mean 20 different things. So this is something where you guys, whoever has a spa out there, will have to do a lot more research on, or see what develops in the next few weeks as hotels reopen. Retail. So retail is pretty straightforward. They're gonna most hotels are looking to stock up on their personal hygienes and PPP items. They're gonna eliminate any kind of food that they sell in the retail area that is not wrapped. It's gonna be completely capacity controlled. So they're probably gonna rope off the entry so they'll allow one guest in at a time. And a lot of hotels are planning on doing no returns. So what if you buy an article of clothing in there because you're in some kind of resort, and you take it with you, you won't be able to return it. Beach pool activities and fitness. So these are the other ancillaries. Are a lot of they're very close. They're in close proximity to your employees, but they're also high risk. For the most part, what I've seen is that most fitness rooms will remain closed. Most business centers will remain closed. The pool and the beach chair area will be obviously distanced according to guidelines. And pool reservation, one of the advice that the National Pool Association gave was to do reservations in blocks of time limits. So for example, let's say you have enough space for 25 people at your pool. You'll limit that to about 5 people. You'll give them a 2-hour block. You'll allow the people to go to the pool for 2 hours. And then when they leave, you bleach the pool for half an hour, and then you allow the next block to come in. But again, it's going to be reservations and blocks that are allowed into these areas. Housekeeping. So this is obviously the big one. Most hotels are going to forego room cleaning for stays less than X number of days. You know, hotel professionals usually know what their average number of days are, so they'll probably go like 1 day after that, or during or at a time that is reasonable. The room clean scheduling, the room cleanings will have to be scheduled. You can't just do them at any random time. You can't just knock on the door or assume that a guest is going to be gone from the room, because that's probably not going to happen. There's also the option of giving the guests their sheets and letting them do the changes themselves. If they have to change, if they have to have the garbage thrown out, they'll just leave it outside in the hall. That's what most guidelines are suggesting. There's also the idea of leaving the room empty for 1 night after a departure. So let's say that you have, you'll rotate this. So all you have to do is, to whatever stay your guest is staying, just add 1 more night to it. And that night will be an empty night, where the hotel is, where the room is deep clean, or it's, or you let air in, or you make sure that that any kind of infection, it dies in there. And a lot of hotels are buying ultraviolet machines. The hotels that I've talked to that are buying ultraviolet machines are mostly 4- and 5-star hotels. These are machines that cost $20,000 to $100,000. They'll clean the room in about 20 minutes. Checkout. Again, mostly
Robert, we seem to have lost your audio. Are you there? Robert seems frozen at this time. Oh, maybe we got him back. I think we've lost Robert, it looks like. Hopefully we can get him back. Can everybody hear me? Yes, okay. So I think we're going to then move on, and hopefully we get Robert back. Our next speaker is Rebecca Smith. Rebecca comes to us she's the Executive Director of the LMH Health Foundation and Vice President of Strategic Communication. She came to LMH in April 2017 after having 10 years at KU Library. She is a communications specialist, and if you haven't seen her daily email about what's happening at the hospital, what's happening in the county, it's a must read. So Rebecca, welcome.
Thank you. Thanks so much. I really appreciate being invited and being part of this today. I will tell you, I am especially grateful for this particular part of Douglas County. I definitely think that our hospitality industry is what makes Lawrence so special. And what I think has been truly remarkable as we think about everything that's happening in the hospital right now, it was the hospitality industry that reached out first and most frequently to offer assistance, everything from, offering to allow our physicians and providers to stay in the hotels. We had so many restaurants reach out and provide meals and dinners and bring food trucks in to support our first responders and everyone working at the front lines. And that has been truly notable, because I know this has been a very, very challenging time for you. And the fact that you thought to reach out to the healthcare providers first definitely indicates the spirit here in this industry and in this community. And we're very, very grateful for that. I wanted to share three main updates today. First of all, I wanted to provide a little bit of context about unified command in the county. I wanted to share a bit about what we're seeing in testing for COVID-19 from LMH's perspective. And then I'll share a little bit about what the hospital is thinking about as we are reopening or resuming some services here that have previously been on hold. And then, of course, at the end, happy to take any questions that you might have. So unified command is the structure that's been put in place a couple of months ago here, and it comprises leadership from the county, from the city, from public health, and also from LMH. And that structure, I think, is a great example of the collaboration that I think is so notable in this community. There's expertise from a number of different entities, including the Chamber, including eXplore Lawrence. And I think that because of that, we've been able to come around this issue and do some remarkable work straight away. So I have a tremendous respect for my counterparts who serve as PIOs in each of those organizations within Unified Command, and for Dr. Marcelino, too, who has taken the lead as our public health official here in Douglas County as part of Lawrence Douglas County Public Health to help our community understand exactly what it is that we're dealing with. So the guiding bodies that have come together to provide this leadership, I think, has been very formative for us. It's provided us some good guidance, provided us some good insight as to how we navigate the coming weeks and coming months. One of the things that Unified Command has been, I think, most effective in is helping us as a community prepare for a potential surge. So what that meant 2 months ago is a little bit different than what it meant now, because the community has been so effective at really, I don't even think we've flattened our curve. I think we have crushed it into, a plateau. And we're feeling very confident about how far we have come and all of the mitigation efforts that we've taken very, very seriously to allow the hospital and allow our healthcare providers here to tackle this in a way that we can be confident in how we take in COVID patients and how we treat them in a manner that is very, very safe, both for that patient and for our providers and for the community on the whole. So that time for us here at the hospital has been extraordinarily meaningful. We've worked very closely with our infectious disease team to make sure that all of the safety measures are in place that we know will be critical when it comes to dealing with an influx of patients. And as we look ahead, where we go from here, what we're seeing in the way of testing, what we're seeing in the way of infectious disease spread in the community, like I said, we're doing a great job of flattening that curve. Douglas County, in particular, when you look at it compared to other populated counties in Kansas, we've done a great job of making sure that we're taking those infection prevention measures, those mitigation measures very, very seriously. And that has been great. The reality of the situation is that while Douglas County has had a higher testing rate than other counties in Kansas, Kansas on the whole is still very low compared to testing in other states across the country. So when we look at our numbers here in Douglas County, we want to kind of keep in mind that really what we're capturing is just a small piece of the bigger puzzle. So we have done in the last 2.5 months here, I would say we've done about 1,500 tests for COVID-19 through our clinics and through our emergency room. That doesn't include testing that's happened at Lawrence Douglas County Public Health. And as we look at their numbers and look at our numbers, here at LMH, we are about 44, 45, I think, positive cases of our patients, a little bit higher as we look countywide too. I think the interesting thing about testing, number one, as we see the testing requirements relaxed a bit across the state, what that means is that we will see more people tested and we'll see more positives result. And I think that's something that we need to be keeping in mind, because public perception is hugely important as we reopen. And one of the things that we're thinking about at the hospital is that will people understand that as we reopen, number one, we will see infection spread. That's just a reality of reopening. We'll do everything we can to prevent that, but it's a risk of reopening. And we want to be forthcoming about that. And we want to continue to remind people why those mitigation efforts are so critical. I think it's also important to note that as testing expands and as the testing resources, the supplies that we need to test become increasingly available, again, more tests, likely to see more positives. And it's just helping the community understand exactly why that is. And again, why that mitigation is so critical. We did not outrun this virus. We did not wait it out. It's still there. And I think that that's something that we need to be very, very mindful about as we consider our approach to reopening at the hospital and across the community. We have to do this right. We have to approach reopening as a community in a way that is responsible, that is safe, and that is prudent. And there's a few reasons for that. But most importantly, doing this correctly will allow us to continue to head down this path. One of the things that I want you to be aware of, I think from the Unified Command standpoint, is that Dr. Marcelino and other medical professionals are really looking at a number of metrics across the community that indicates how well we are navigating this situation and how well we are mitigating the spread of infection. And if those metrics begin to creep up in certain areas, we need to be prepared for the fact that we might have to go back to a more conservative approach in how we consider ourselves to be open as a community, and certainly how we consider ourselves to be open as a hospital. So I think that the number one thing that we all need to be keeping in mind as we head down this path is that we're going to have to be very, very flexible, and we're going to have to be very transparent and hopefully proactive in communicating with our stakeholders about what those metrics are and what we might need to change as we go forward in order to keep our community safe. So I think opening is, we're going to have to be flexible. And while it's wonderful to see the opportunity to head down this path because our community has done such a good job at infection mitigation, again, we have not outrun this virus, and we have to be conscientious in order to ensure that our rate of infection stays low. So on the hospital side, when we think about resuming elective procedures, it's a couple of things that we're keeping in mind. The most important thing that we want our community to know, and I think this might be relevant to those of you who are opening other businesses as well, is that this is a safe place. I have, my grandparents are in Nebraska, and they've been very reluctant to go to what are pretty critical medical appointments because they don't want to be exposed. And what I keep saying is, I'm like, the hospital is the safest place. This is, our area of expertise when it comes to infection prevention and mitigating the spread of even something like COVID-19. And I really appreciated Robert's comments about illustrating through your marketing materials and by showing your guests exactly everything that you're doing to keep them safe. What used to be maybe back of the house or something that we didn't want to do in front of our patients or in front of our customers, now I think is something that illustrates a higher level of care for them. And so that transparency, I think, is very, very important to begin to put people's minds at ease, because this is a concern. They're concerned about their own safety and health, and they're concerned about the health of their families too. So within the hospital, a few key things that we are doing that may be relevant to you as you think about reopening. Number one is screening. So we're making sure that every single person who comes into our facility, whether it's a surgeon or whether it's a patient coming in for a diagnostic mammogram, that they're being screened at that front door. And the way that screening takes place is via just a form that fills out that tracks on the Kansas Health Department's metrics. We're looking at what might increase your level of risk. We're also doing temperature scans, again, for all employees, all patients, anyone who comes into our facilities. I think that that's the number one thing that we can do, in addition, of course, to masking. Again, every single person at all times in our facilities is masked. I'm sitting across the street today in our foundation offices, but if I were over in the boardroom later for our incident command meetings, I'm going to be masked, and so is everyone else in that room. I think the other important factors that we're looking at is the social distancing, again, that Robert talked about, making sure that we are looking at our waiting rooms. And first of all, mobile waiting has been, I think, will be a big, big change for us. So instead of asking patients to come in at the time of their appointment, we're going to ask them to wait in their car. We're going to call them when it's time for them to come in. But where we do have the opportunity for maybe patients to congregate, maybe at the pharmacy or something like that, we're looking at laying out signage on the floors. We're looking at making sure that our chairs and tables are as separated as possible. That sends a visual cue, a visual reminder to patients that this is a pandemic and that they need to take this seriously too. I also have really appreciated Robert's comments about the distancing police, because that's something that we've been hearing a lot about too, that we have to be very, very mindful and really, kind of lead that charge, especially in our own facilities. And we're reminding our team members constantly that even though you are masked, that distance is still really crucial. As we look at communicating with our patients, we are doing our best to be, again, very transparent with them so that they understand what to expect when they do come back, because it is not business as usual. And we have spent, I think the healthcare industry has a lot to learn from hospitality. Consumerism is something that is very, very new in healthcare. It's something that we're paying a lot more attention to. And that experience that you have when you come in for a doctor's appointment is getting, I think, more attention than it used to receive. That said, right now, we're setting that aside a little bit and we're asking our patients to be a little more flexible, to maybe expect some delay, to expect some challenges as we navigate some pretty significant and new systems that are really meant to keep them safe. So being honest with them at the outset, to say this isn't going to feel like it normally does, and it's probably not going to run as smoothly as it typically might, but that's because your safety is more important than absolutely anything else that we're doing here. And so just setting that expectation at the outset, I think can help put people at ease and help them understand exactly why we're doing what we're doing. The last thing that I would mention is just, as we have resumed as we've resumed the operations that we had set aside, but even as we look at what we have continued at the hospital over the last many weeks, the number one and only constant is change. Every single day, sometimes multiple times a day, recommendations will shift. Supply levels will dictate, an approach that we're taking. Some new information from our infectious disease team will have us look at a situation a little bit differently. We've had to be very, very flexible, and we've had to ask our teams to be very flexible in adapting to this change. And so as you look ahead and you're thinking about what opening looks like in a week or a month, recognize that that could change based on any number of factors, and that any infrastructure that you build at this point, may need to be adapted down the road. And again, I think understanding too that there are triggers and metrics that our community will be watching at that unified command level, at that public health county level, that would have us pull back again into a more conservative approach. And in my mind, that's all the more reason for all of us as leaders in the community, as business owners in the community, as community members ourselves, to take very, very seriously the mitigation efforts that we need to be engaging in. We need to be wearing masks in public. We need to be social distancing. We need to be limiting our circles as we do expand. We have to be so careful and conscientious to protect our community, to protect our hospital's ability to care for patients in the event of a surge. Continuing to flatten that curve is so critical. That's what's going to enable us to continue reopening at a rate of pace that we know is important for our local economy and for all of our business owners here. And it's important for the safety of our community and our patients as well. And again, my thanks to so many of you who have been so incredibly generous with our healthcare providers and with our community hospital over the past few months. It has absolutely not gone unnoticed, and is, like I said, truly just a measure of how incredibly special this industry is to our community.
Rebecca, thank you so much for your sound advice and your guidance as we continue to move through this. I'm currently in New York, but I'm coming back shortly, and the go-to watch is Governor Cuomo every day, and he talked about opening the economy by slowly opening the faucet. It's not a blowout. It's going to come back in parts, and I think that what you said basically echoes that. Rick, we're going to hold the second before we bring you on. Robert got back on. Thank you for coming back on, Robert. Comcast went bad for a second. He's got a couple more slides he wants to share with us. So, Robert, share your slides, my friend.
Yeah, sorry about that, Rick. Sorry to bump you there for a second. I just wanted to get to these last two slides, and I can't agree more with what Rebecca said. You know, there's a lot of the statistics that are coming in from all over the world are showing that actually the more you wait, the faster you can restart. So it's almost like it's a balance. It's an optimization balance about when you decide that you're gonna start opening up that faucet versus when it's actually the right time to do it. But anyway, regardless, I wanted to make sure that we got to the back of the house because, as I said, there's, you know, taking care of the employees is just as important, or maybe even more important, as taking care of the guests. So the same screening that you do for guests, you should be doing for your employees, and there should be wash stations and cleaning and PPE materials and everything. Every entrance at the offices, you should be closing all your meeting areas. There's no reason for people to be interacting that way. We're all interacting right now through Zoom, so there's no reason for anybody to be in the same room with each other. The cafeteria is going to be an issue that you're going to have to schedule out when people can actually come to lunch and when people could come in and out, and the locker rooms also. But more important, you got to screen your suppliers too. Anybody that's coming into the building. You know, I started off in finance, and in finance we have a saying that all expenses come in on 2 feet. Well, now all diseases come in on 2 feet. So you got to make sure that anybody that comes into the building is being screened the same way that everybody else is being screened. The last thing that I wanted to get to is that there's a lot of questions that haven't been answered. I've been listening to a lot of webinars, and people bring up questions that there are no answers to. For example, you know, if I want to do pre-arrival communication with my guests because I need to tell them something about the guidelines in the hotel, I can't do that because the OTAs don't supply me with the contact information for these guests. In other words, another thing is asking guests to remove their masks so they can be ID'd is something that is actually healthy to even do. You know, can I ask somebody based on HIPAA rules? Can I really ask somebody if they're sick or not? Can I ask a guest, have you been sick in the last few days when they come in? Against privacy rules. If I ask somebody to email me their ID, their credit card information, is that a PCI concern? Cash tipping. Are we going to allow anybody to touch somebody else and give them cash, Bellman or anybody else? Groups and meeting spaces, that I found very little information on. That's still up in the air. What people are going to do when it comes to events and when it comes to how they're going to host groups. So this is something that I guess we're going to work through as we go along. And then I think the biggest issue that's going to happen for the hotel industry, and you could quote me on this, is the competition for cleaning staff. Every single industry right now is going to be competing for the same people that used to work for you. And there's a perfect storm right now going on with COVID-19, with the fact that a lot of cleaning people are getting paid more under unemployment than they are getting paid at work. And also because some of the immigration limitations that we have going on right now, there's going to be a massive drought when it comes to cleaning staff. So that's where you're going to have to put a lot of attention and make sure that your HR department is focused on, because I think that that's going to be a major issue across all industries. That's it. That's all I have for now. Rick? Michael?
Thank you. Thank you, Robert. That was a great presentation. I'm sure this gives some questions people want to ask you. And before we do that, we're going to turn it over to Rick Martin. Rick is the founding chef and co-creator of Limestone Pizza, which is my favorite pizza place in town. He also is a restaurant consultant, and he teaches a number of classes at Adora High School, Lawrence College and Career Center, Flint Hills Technical College, Just Food. And he has been one of the great leaders in our industry here in Lawrence, and we look forward to hearing your remarks, Rick.
Great. Can everybody hear me?
Yes.
Awesome. Well, thanks, Explore Lawrence, for having me on here. Just made a few slides just to make my points known. I do want to start by saying I want to recognize that the restaurants are in a dire crisis and disaster mitigation, if you will. So first and foremost, I think it's important to point that out. Thinking about reopen is difficult for a lot of restaurants because there's still such a triage mode going on of taking care of the bills and the loans and the staff that was really put the thought process behind, regardless of the phases and the timelines and the guidelines that have been put out there. So my speaking direction will definitely be assuming that looking at the attendees for this meeting, that most people are in small independent restaurants or restaurant support organizations. And I think that's important to note, that it's the small independent restaurants that are being most affected by this for a lot of different reasons. So that being said, I want to talk a little bit about where we're at. Most restaurants that did decide to stay open are working in a curbside carryout model, some with delivery. Restaurants that I, for one reason or another, have access to some numbers. I know firsthand that it's not profitable for most. It's definitely costing restaurants a lot more, both in cost of goods and also especially in labor, because the lower sales, of course, make those percentages spike. And it just takes, for a restaurant to change what they're doing, a restaurant is designed and built for a specific concept and purpose, and to change what you're doing in your service model, it just requires a lot more people. So as we think about reopening and being in that mode, I think that it's important to stay adaptable and take all of these things that we've learned from changing our concepts, and keep in mind that we're going to have to keep reusing and bootstrapping with this mentality of things are going to change fast. Just as we thought a month and a half ago that things wouldn't be canceled and things wouldn't be closed, and it all happened just right before our eyes. I think that as I talk about reopen, we're going to see a lot more of those things. And so reusing a lot of that mental space is going to be very, very important. Restaurants that are lucky to have a drive-through are doing okay. Those drive-throughs really help out. And I think that those will be extremely valuable in the time to come, because of the usefulness and the distance that can be achieved through the drive-through. One thing that we're seeing a lot of, though, is just the reduced customer service interaction. And we're talking about a large group of people that do this work because of the customer service interaction. Restaurant people love to see our customers. We love to get the reward of seeing people be satisfied by the food and the service and the beverages. So that's certainly a big change that we're dealing with right now all around. And I think that that's still going to be a part of the service for some time to come. And we'll talk about that a little bit more as we move along. Also want to talk a little bit about the strengths of the restaurants, in that, restaurants can be very resilient. Again, the bootstrapping attitude of we can get through anything is really important right now. And thankfully, we are strong together as well, especially in our small independent restaurant world, that we all help each other out. And we've certainly done a lot of that recently. And we can talk more about that in a minute. So that's a really important thing to keep in mind as a customer, or for those of you that are in restaurants. There's a lot of resources out there, a lot of other people that want to help and want to share ideas. So take advantage of those resources. The Lawrence Restaurant Association, Downtown Lawrence Incorporated, Explore Lawrence, all of these organizations, we all want to keep the strength together. So keep that in mind as we move forward as well. I think a great plus has always been that restaurants are already known for strict and rigorous sanitation and cleanliness. Regardless of the things that get printed about the inspections, those are certainly documents to show that the Kansas Department of Agriculture is doing their job to make sure that all of these restaurants get inspected and that nobody's perfect. But I do think it's important to point out that one of our strengths is that we already have all of the sanitation knowledge and education in our hands. And my hope is that we don't spend so much on COVID defense that we end up seeing a spike in other foodborne illnesses because of it. So we need to be mindful of sanitation being just as important as it always has been regarding all pathogens, not just COVID. So keep on those self-inspections for all things, not just for COVID. And we'll talk about the COVID guidelines in a moment. But also adaptability is certainly so important with restaurants, and it's going to be paramount in the times to come as we, I told a group that I was talking to the other day that it feels like we're trying to steer a ship into a cave with no light. And we just don't know, what's on the other side and what's going to happen next. Again, regardless of the guidelines and the phases that have been put out there, every restaurant is so uniquely individual that a problem that one restaurant experiences may not happen at another. So the adaptability of keeping that strength and open-mindedness for what might happen next is extremely important. Some of the weaknesses that we all need to keep in mind as we move forward with this is that, as restaurants, we're usually pretty financially unprepared. And we see a lot of government benefits that are helping out with that right now, but margins are usually small and assets are pretty weak because we don't have a lot that is worth anything in restaurants. So restaurants end up kind of dangling, and what we are seeing is that if I average most of the smart opinions out there with my own, I think that we'll see 50% of restaurants recover from this in some way. Now, when I say recover, we don't know what we're recovering against right now. So restaurants that aren't adaptable will suffer greatly, and restaurants that are adaptable to what might be on the other side will do a lot better. But we need to, of course, support the restaurants and listen and keep an open mind. And for those of us that are in restaurants, again, being financially smart at this time is extremely important. We have a very fragile workforce. We have about 8 million people that are probably unemployed right now from restaurants in the US, and that's a large number. A lot of them will find work elsewhere. In Lawrence, a lot of our restaurant workers are very young and have relocated to live with parents or family because they couldn't afford to be without work right now. So we're really hoping that we have staff that can return when we do reopen. But it's certainly a crisis that we'll all have to think about and what sort of measures we have to take to get people back in those positions when we can. We've already had, we've always experienced great turnover in restaurants. Generally about 50% of your staff is going to turn over on an annual basis. So a lot of retraining, a lot of safety measures, a lot of reassurances are going to be super important as we approach reopening, and the length of time that that's going to take. So I want to talk a little bit now about the phases and some of the details that are involved in that. First of all, what restaurants will even reopen. Some may have already closed. Some may close at a later time after the business perhaps doesn't come their way. Or maybe some just aren't able to find staff. We know that a lot of restaurants will choose to stay closed. A lot of restaurants that are going to choose to stay closed have the financial abilities to do so, or are planning some sort of financial plan that will help them through. So we certainly want to support those restaurants that will choose to stay closed. It's going to be a decision for each restaurant based on safety concerns for their customers and their staff. And we will hope that the restaurants that decide to open up will, of course, do everything within their power to be safe and provide as much information and data for all of their customers that we can. The big question is who will dine out. I've spoke to a lot of people because these are the details that I'm really interested in. Is reopening doesn't mean that people are just going to rush out and go to their favorite restaurant. Certainly a lot will. And, we're going to have other things that will play into that. But we hope that the customers that are out there on May 18th eating in restaurants have been safe and quarantined and doing everything in their power to stay healthy. Because that it will be a big challenge, is just the anxiety of what might happen as we do start to reopen things. I related it to going to the grocery store about 4 weeks ago, as that was a very stressful and anxious experience. Getting used to a mask and getting used to seeing other people in masks. And just the collective anxiety that was out there at the time. I think we're all kind of getting used to that experience now, but we're going to kind of walk through that again as we see a different world in our restaurants, and it's something to get ready for. We want that experience that we had. The customers are going to want that experience, and if it's an assumption that when restaurants start to reopen that experience is still going to be there, I think we're wrong in a sense. It's going to be up to the restaurants to do everything they can to provide that experience and rethink the world of customer service as we've known it, and make sure everybody feels very comfortable and very safe. But it's going to be a different experience, again, until we start to get used to the new way of doing things. And that, I think, will be the biggest challenge, and kind of the greatest thing that we remember is that it felt very different, that all of the things that we now have to do to keep safe will alter that feeling that we get from dining out and sharing food and beverages with other people, and the service level that we get. A lot of people that I've spoke to as customers are not planning to eat out anytime soon. So we just don't know what the numbers will be. Will it be a trickle? Will it be a rush of people? If there's not a lot of restaurants reopening, it could seem busy for some, but again, adaptability on how many people you need to have on staff and what to expect. It's going to be completely new for everyone. The supply lines are certainly fragile. We've seen a lot of things that have been running out through our large food service suppliers. And they are certainly letting the restaurants know that there will be shortages. There will perhaps be mass shortages in some areas. We're still seeing lack of sanitation supplies, odd things like beef brisket. Apparently, barbecue restaurants have done really well through curbside and carry out and delivery, and there's not a lot of beef brisket to be found out there, as a lot of the manufacturers have slowed down production. Beef is usually the only product or the only beef product that most barbecue restaurants use is brisket. So it certainly has hurt that industry. Things like single-use food service gloves, as restaurants start opening up, we could see shortages on those sort of things, which also fall into the PPE category for us. So if that happens, that's a requirement that most restaurants wouldn't be allowed to be open if all of a sudden gloves aren't available. So it's certainly something to keep in mind. Companies like Cisco are limiting a lot of the in-demand supplies that they have. If you, as a restaurant, have never ordered your paper towels or toilet paper through them, they're not going to allow you to purchase it, and they're going to save those for customers that were using it before. And I think a lot of that is just to prevent the hoarding. And we'll have to wait and see what the new things to be hoarded will be. So certainly something to keep in mind. For the PPE, we have to really think about what's going to make everybody feel safe and comfortable. Masks will be required here in Douglas County, and masks are not going to be provided, which is going to be an issue. The Restaurant Association has just made a purchase of 2,000 cleanable, reusable, cotton breathable masks that will be logoed for the Restaurant Association, and those are going to be available at cost. We've posted through our Facebook page basically a pre-order post that if a restaurant would like to have those masks, I would suggest 2 for every staff member. We can get you on a pre-order list, and that would really help the Restaurant Association know when we need to reorder more, because we would like to make sure that everybody that is in restaurants has those available and ready to use when they choose to open up. And certainly, just back to the gloves, if we can avoid any sort of hoarding on the gloves, I think that's going to be good for everybody. And certainly I've already talked to a lot of restaurants that are willing to share. If it's just, hey, let's get you through a day or two, certainly reach out, ask. There's a lot of restaurants that want to make sure that we help each other out. A lot of the standard operating procedures that we'll see, a lot of training new things, a lot of training for things that we don't even know the outcomes of yet. But making sure that things like tables and chairs are cleaned and sanitized, door handles, any touch points. Bathrooms have been a really hot topic of discussion because there really isn't a lot defined in that yet. But Will bathrooms need to be cleaned after each customer use? Can a self-cleaning station be set up in the bathrooms? I've talked to one restaurant that's going to take a door off of one of the 3 bathrooms and turn it into a hand washing only room so that anybody at any time can go in and wash their hands and not take up a toilet space. So those are some creative ways of thinking, some things that, I would hate for those to really stump people as they get to that point, but bathroom cleaning is going to be of extreme concern. And, we might even get back to the days of having a bathroom attendant where there has to be a person there that's monitoring it as their job full time. So those are certainly more touch points that will need to be addressed as we move along. But the biggest concern on a lot of lists that I'm seeing is simply cleaning procedures being posted and being displayed. More important on the list than face masks and gloves is cleaning procedures. So keep in mind that, again, like Robert said before, the sanitizing and the cleaning actively happening is going to make people comfortable, whereas it might have made them a little uncomfortable before. Probably the biggest challenge that we're going to have is staff. Will they even be available, and will they feel safe? I think about 50% of staff are telling restaurants that they're likely to not come back even when things reopen. So that creates a really huge hole in what a restaurant does on a daily basis, which is use people to have that customer service interaction and actually produce the food. We hope that in Lawrence, it will be a little bit better than that. The Lawrence Restaurant Association has created a crisis fund that has so far distributed about $80,000 to people, $250 at a time, just to provide these unemployed restaurant workers with some groceries or some money for bills, to hope that they will still be there once we do get open. So it's important to support that. And if you have a restaurant, to make sure that you do encourage your staff to apply for that. It's a very easy application. All that we need to see is a pay stub that showed that you were employed at a restaurant in March, and those funds get distributed very quickly within a day or two. And then once we do start the process, interviewing and the process of hiring is going to look completely different. As managers get used to FaceTime interviews and Zoom interviews, it's going to be more time consuming, and it's going to change the way that we think about bringing on new staff. So again, important things to keep in mind. One of the biggest issues that I'm feeling is just, a relapse. If we do have a second wave, I don't believe that restaurants can survive that. So it's so extremely important that we stay safe, we use these guidelines, we use the masks, and we make sure that we, as restaurant people, if we feel sick in any way, we don't go into work. And we certainly want to make sure that we let our customers know that we would respect that of them to not come into our restaurants if they are sick in any way, to avoid any relapse. I think it's the one industry that just with everything that restaurants have been through so far won't be able to handle any second wave of the COVID virus. And then, ongoing financial crisis, it's not going to go away for a lot of the restaurants, even after reopening. So it's so important to continue to utilize any government help and government benefits, keep the wheels on, and we'll just have to really hope that we can survive this, and that reopening is prosperous for everyone. As customers, we have to, again, reciprocate within that as well. And finally, just to talk for a moment about adapting. I know I've touched on that quite a bit, but we're seeing a lot of restaurants that will be permanently adapting, and I know of several restaurants that were due to open this spring or this summer or this fall that have already adapted their concepts. We're seeing a lot of ghost kitchens that are popping up to do more curbside carry out and delivery type of concepts without having your traditional brick and mortar type of establishment, which, I think that's extremely smart and adaptable. But we certainly need to really focus on saving our existing restaurants before we completely turn our attentions in the way that I'm seeing it. So with that, I will end my presentation and let us get on to these questions that we might have.
Okay, thank you so much, Rick. We haven't seen a lot of questions, but I do have one question for everybody. As we move through this, Rick and Robert and Rebecca, how are you going to communicate the message that we're prepared for your visit? What are tools that you want to use? Robert, you talked a lot on your presentation. Rick, how are you going to communicate that we've done everything we need to do to make the customer feel safe?
Well, I like what Robert mentioned about hotels, the photo galleries being one of the most important, or one of the biggest hits on websites and such, and identifying those customer points of contact virtually, I think would be really, really important. And probably social media is going to be first and foremost for the restaurants. That's generally how we communicate with our customers, is through social media. So preparing your data in your own personality, just like you do with your social media. Your social media has a personality, and I think that this messaging has to be the same. If it goes out as a sterile copy and paste, it's probably not going to sink in as much as if it really comes directly from the managers and the owners as a heartfelt message of how we all want to deal with this together.
Okay, thank you. Rebecca, anything you want to add?
I think Rick's comment was spot on. I think that those of us who work in communication, we're holding those communication plans in our hands, and we see that list of tactics, and we feel like we've checked all of our boxes, that we've shared this information far and wide. I think we can trust that we're going to need to continue to share it, that we can communicate it again and again and again, and know that it still might not hit. So I think we have to be really persistent, and we have to be very proactive in helping our audiences know what to expect and where we go from here. And it's going to probably feel like maybe we're doing that too much, but I think that's the side we should err on right now.
Okay, Robert, anything you want to share?
I agree with Rick and Rebecca. I mean, I think the biggest challenge is going to be for the restaurant industry, not necessarily for the hotel industry. Post financial crisis, we're seeing, I think, a renaissance in the restaurant industry again. With the quality and the type and the variety of restaurants that were, especially here in the U.S. And then all that just stopped because of this crisis. But restaurants are a lot better at using social media than hotels are. So they're definitely, they could definitely get closer to the customer faster than hotels can. So, hotels still have a lot of work to do with that. So, if I'm a restaurant, I would keep that social media communication going. And as a hotel, hotels have a vast amount of email resources, so they could communicate, they could continually communicate with guests just based on the emails they've collected over the years. And then on social media, of course, just be transparent about what you're doing at your hotel to mitigate this. you know, everybody, we're all having the same conversation, so don't try to avoid it. You know, I really, right now, I don't really care if a hotel tells me how great their view is from their penthouse room. I really don't care. What I really want to know is how deeply they've cleaned the average room that I'm going to stay at. So, yeah, that's basically what we're going to see.
Okay, well, I want to thank you all for giving us your sage advice. We're going to have a recording that's going to go up in the reopening page on our website. I'm also going to share the decks that were provided by our speakers. And again, thank you all, Rebecca, Robert, Rick, and again, thank you everybody for participating. If you have any questions, just shoot it to us and we'll help to answer them. And we'll all get through this. We absolutely will, and we'll be better for it. And I look forward, Rick, to come sit into the restaurant and having some pizza with you. Have a good day, everybody. Thank you.